Hello, beautiful people, and thanks so much for watching us here on Great Day, Louisiana. I'm Malik Mingo. I hope you're doing well today. I also hope you had a fantastic weekend. Look, we have a great show for you all today. We're beginning in our LCMC Health Wellness Lounge because, look, October is Breast Cancer Awareness Month, and it is always important that we have a conversation about this when it comes to detecting breast cancer, preventing breast cancer, and what to do if you do find a lump. Joining us now for a conversation is Dr. John Colfry III. He is a breast surgical oncologist with Touro and LCMC Health. Wearing your pink today, my good sir. Nice to meet you.
Great to be here. Great for having me. Appreciate
Of course. Thank you so much for coming on to talk about this. And you know, I don't want to stick too much on talking about what it is, right? Because I feel like at this point, because every October is Breast Cancer Awareness Month, we've done a great job of bringing awareness to it. But I'm so curious, when we look at the research today, right, 2025, which groups of women are being most affected by this disease?
If you look at the data, the average age for getting breast cancer is still 70, right in 69 to 70.
Really?
We worry more if you're younger and have a family history of breast cancer, meaning like first degree relatives, like a mother and a sister. That takes more priority than like a second or third degree relative. But if you look at all comers, still average age for getting diagnosed is around 70.
And have we found out why it's at that age? Is it because of the lifestyle that they live? Just, you know, not the wear and tear, but the wear and tear of the body?
It's a great question. For all cancers, really, as we age, our cells lose the ability to repair itself. So if there's an error in your DNA as we age, you just don't repair it as well as you did when you were younger. And so that's why you see most cancers incidence is highest a little bit later in life.
And of course, we've heard about the different stages, right? Stage 1, stage 2, stage 3, stage 4. But are there also different types of cancer? How are those determined?
Most important thing nowadays is what actual flavor a patient has. And basically, the biggest determination starts with whether they have an estrogen hormone cancer or not.
Wow.
If you're hormone positive, the estrogen positive cancers are a little bit less aggressive, and the estrogen negative cancers are more aggressive. So that's kind of one of the big forks in the road for us. And then kind of from there, if you're estrogen positive, you typically go to surgery first. If you're estrogen negative, you have to have chemotherapy first and surgery second.
And of course, we don't want anybody to have to deal with that. So prevention is key. Of course, get your mammogram, once a year?
Once a year.
And what age do they start?
Starting at age 40.
Starting at age 40, and unless you have like maybe a genetic or hereditary element, do you go a little bit earlier?
If you have like a mother or a sister, we usually tell you to go 5 years before 40, so about 35. But it's super important to make sure you go talk to your family about their family history so you can know these things. If you need to go earlier, then you need to go earlier.
It's good to know, and I love that we're talking about this. So for all my women out there, have these conversations with your loved one, especially the women in your family, because if you haven't talked about this, it's so important, because at the end of the day, we don't want anybody to get this. Another thing that I find that women also need to know is the importance of getting a self-exam, doing it yourself. Can you kind of show us, I wish we had a little diagram, but we don't, how to do a breast self-examination?
Right, if you look at the guidelines nowadays, the buzzword that they use is women's self-breast awareness.
Okay.
But that really means, yes, being aware of your breast, but we always tell people easiest way to check the breast once a month is when you're in the shower and everything is soaped up. Just let your hands gently glide over the skin on top of the breast, feeling for any hard masses. Also key, typically not painful masses. Breast cancer is typically not painful.
Is it just the top, or do we look under as well?
Under 2, yep.
Okay, so over and under, and notice how he said once a month, so everybody should be doing this. Now, say they do feel a lump, say they do go and get their mammogram and something does pop up. What does that look like? What is the next step?
The next step, honestly, is having the courage to make the phone call to go get it checked out. I can't tell you how many people we see that they're just kind of self-delude. They're like, oh, I'm going to ignore it and it's going to go away. But the best thing to do is have the courage, make the phone call, go get the mammogram, and then from there you might need a biopsy or something else.
And prevention is key. Early detection, it can improve your outcome. The survival rates are higher, and of course recovery can often be easier. But we hear this word all the time when it comes to breast cancer: mastectomy. But I love how you say that surgery isn't always just the treatment, it can be the prevention as well. Tell me about that.
Correct. And so, if you have a family history, a lot of people will go get a genetic test to make sure that they didn't inherit a gene that could give them breast cancer.
And it's called the BRCA gene, right?
That's one of the genes. That's the most common one that Angelina Jolie made very famous.
Yeah.
And if you have one of these genes, it's good to know about this up front, because nowadays you can have preventative surgery to prevent yourself from having chemotherapy and radiation and some of the things that are harder on the body.
And what does the next 20, 30 years of breast cancer research look like for somebody in your field? What would you like to find out?
We're in pretty exciting times for breast cancer. The medicines are getting better and better. The chemotherapy medicines, some oral medicines, and one of the biggest things that's going on right now is there's a breast cancer vaccine.
Really?
That they're in clinical trial with and is showing a lot of promise.
And that's to what? Prevents it, or if somebody has breast cancer, it helps treat it?
Great. Both, really. They're starting out by looking at it in the treatment phase, and then their plan is to trial it in the preventative phase. So for example, if you have a certain type of breast cancer, like we talked about earlier, the estrogen negative.
Correct.
They're treating those people and starting to vaccinate them to see if that can decrease the chance of a recurrence.
Wow.
With the vaccine than without the vaccine.
This is fantastic, and this is so interesting. Look, I want to thank you so much for coming on the show, Dr. John. Not Dr. John the musician, Dr. John the oncologist, okay? Surgical oncologist. Look, if you all have more questions about this topic, make sure you log on to lcmchealth.org for more information on how they can help